Hi, and welcome to the Dr. Mia Paquin podcast. Today we are joined by Dr. Raja David, and we are so thrilled to have him here to talk about therapeutic assessments. Welcome, Dr. David.
Thanks, Mia. Appreciate being here.
Yeah, I am so excited to talk about this because I think this is kind of a new area that psychology is going into. And I think even psychologists don't know a lot about this topic.
That's true, too. Yeah.
Before we dive in, tell us a little bit about yourself.
Sure. Well, my route into the field is a little different and a little humorous, so I'll just share that real quick with you. So I spent roughly the first year of my life living in a residential treatment center for boys.
Oh, wow.
Very atypical for infants to be in such a setting, of course,
Yes.
but my parents were both frontline staff at this residential treatment center called Children's Village in Dobbs Ferry, New York. It is still there. They're still doing great work. And this was the 60s. I was born in 1969. And so at the time, the thinking around a treatment facility like this was you had two married adults who were the primary kind of caretakers, if you will, in the house. And these were children from primarily New York City, pre-adolescent age children, often who had experienced trauma, whose parents were incarcerated, parents had drug and alcohol problems, and required kind of extra care given some of their behaviors or what was going on from a mental health standpoint. And so my parents had this apartment on this cottage, and this is where my sister and I initially lived until, the story goes, one of the boys dropped me on my head. And my parents were like, I think we need to find our own house. So we moved into Dobbs Ferry, into a house there. But it speaks a little bit of the path I have been on, because my parents really were social workers who believed in the importance of helping other people. And so I grew up with that value and always kind of knew I was going to be in a helping field. Originally, I thought I'd become a guidance counselor. And that led me actually on a path towards getting what's almost like a dual degree in my undergrad program in psychology, and I got certified to teach at the same time.
Wow.
So when I graduated, I was actually teaching middle school, high school social studies in Western New York, Fairport, New York, outside of Rochester, and loved that and loved teaching. But unlike a lot of social studies teachers, I like teaching and I like being with kids, and like the history part of that was kind of secondary for me. And so in my mind, I'd always thought about, am I going to maybe become a guidance counselor, or maybe I could become a psychologist?
Yeah.
And my path went a couple ways, but then eventually I applied to a doctoral program, the Minnesota School of Professional Psychology here in Minnesota, and got into that program. And then I didn't really know that much about the field of psychology when I entered, and I knew almost nothing about psychological testing, actually.
Wow.
Yeah, and this was a program that was heavily about psychological testing, actually. So I quickly learned.
Yeah.
And it really was the class on the Rorschach where I was like, this is really cool.
So the Rorschach is a test.
So the Rorschach inkblot test is one of the oldest psychological tests that we actually have. It's been around since the late 1920s, 30s. And it's what's known as a performance-based measure that helps us understand various parts of people's personality, really, but goes about in a very different way than some other tests do. And so I got fascinated about that, got really into assessment, became essentially a child psychologist, was doing a lot of therapy with kids, adolescents, families, but always have done psychological testing as part of my work.
Wow.
Eventually got into academia, was a professor for a while, and then when the Argosy system as a whole collapsed, I grew my private practice, which is the Minnesota Center for Collaborative Therapeutic Assessment. And really since 2012 or so, my passion has been therapeutic assessment and practicing it and teaching it and helping people integrate it into clinics and helping professionals understand how to do this model as well. So that's kind of the path.
So if we were thinking about the field of TA, you are one of the top people in the field. You have done a lot of work.
That's correct.
Tell me a little bit about what you're known for in terms of therapeutic
Sure.
assessments.
So within the therapeutic assessment world, Honestly, the way I've kind of got here is I discovered the model, did some intensive trainings on it because I thought it was so interesting and so helpful to people. And it really aligned with big parts of why I got into psychology, trying to help people and understand people. And it was so impactful with clients that also, aligns with my values. And I was teaching at the time, and I had a private practice, so I was able to practice it, but I was also in a place where I could develop a doctoral level course on it. And so I developed a doctoral level course on therapeutic assessment and taught this elective. And so I was able to help many students actually understand the model. And then that led to building some workshops around it and doing a lot of presentations on the model, largely for professionals, sometimes at conferences, sometimes through my own business. And then I started doing some writing on it and eventually was asked to join the other co-authors of the Therapeutic Assessment with Adults book, which is like the primary book on the TA model, therapeutic assessment, or TA we sometimes refer to it as. And so then that, of course, you write a book and you teach something, then you really know something well.
Yes.
And so, people talk about the 10,000 hours. Like I got the 10,000 hours in on understanding this approach. And now, I'm really very passionate about teaching. And so still I'm doing a lot of workshops, but also still want to keep helping people. And so still do a lot of clinical work as well, mostly with adults these days. I do work with adolescents quite a bit as well.
And this is a model, though, that can be used on kids, adolescents.
Yeah. So there's 4 therapeutic assessment models. And maybe if I can, Mia, take a step back and let's define this term here. So therapeutic assessment is really a collaborative form of psychological assessment designed to help clients gain insight and make changes in their life.
Okay.
And it helps to contrast it to what in the field we refer to as the traditional information gathering model of assessment, which is what is predominantly practice.
Right.
And, the field of psychology largely followed the field of medicine. And so there is a medical model that informs how doctors do things like assessing and treating.
Yes.
And so it only made sense that psychology also was approaching assessment and treatment in similar ways. And so a lot of the traditional model follows that kind of approach. And the analogy I like to think about a little bit when it comes to therapeutic assessments and how it differs, if you go to a doctor because you think you have a broken bone, and the doctor says, well, go get this x-ray and it'll tell us what's happening, and that data will guide treatment decisions.
Yeah.
Well, in that approach, which is, of course, really helpful, we want that, but we don't expect the x-ray to lead to any healing or change.
Right.
It's only providing data to guide decision-making for the doctor in this case. When we are doing psychological testing with people, we have this unique opportunity to explore with them through conversation about, well, what does this actually mean for you? We are all unique creatures.
Yes.
And none of us are alike. And, I can give 10 people a test that come back and say, these 10 people have anxiety. Well, that's really 10 different types of anxiety.
Yes.
And so I get super curious about what does this anxiety mean for this person given their current circumstance, the world they're currently living in, given who they are, their personality, and given the life they've lived. And getting a more holistic and in-depth understanding of someone and helping them build some insights around themselves is part of what's so powerful about this model. And just to come back then, so in the traditional model, it's often the case, of course, people leave and feel like, oh, I've learned something here about a diagnosis or what I need in treatment. I don't mean to say that doesn't happen, but the focus of the traditional model aligns kind of with what I was saying about an x-ray, right? The focus in that process is more about, we're trying to get data to help guide other decisions.
Right.
Whereas in the therapeutic assessment model, we really want the client to get this better understanding of themselves, get things clarified. And what some of the research would suggest is that occurs, and for some clients, their symptom picture even starts to improve. They're better able to use treatment in a way that perhaps they haven't been able to beforehand. Things like self-esteem, hope sometimes can go up for people as well. So it's got this mix, as the title implies, right? It's therapy and it's assessment combined together.
Which makes so much sense, right? Because oftentimes, clients, they want answers, right?
Yes.
But, they want answers because something's not working,
Right.
And so not only do they need to know what's wrong, but why is it wrong? How
Right.
do I fix it? Can I fix it?
Right.
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 And so that makes so much sense. So a regular assessment, what would that look like?
Sure. And so in a traditional assessment, the primary reasons people are being referred for that type of psychological testing is because the client or perhaps someone who's referred them, a psychiatrist or a therapist, or sometimes schools with kids, want to know what's the diagnosis.
Yes.
And so questions like, does this kid or does this adult have ADHD, or is this autism spectrum disorder, or is this bipolar disorder?
Yes.
And so the focus of a traditional eval is usually around that question. And then what occurs is we gather data through interview, through testing, often through collateral information like a review of records or maybe talking to that referring party. And the psychologist's job is to pull that together to essentially answer that question. And so that's all very valuable. In no way am I saying we don't need that or don't want that. That can be really helpful to people. What's a little bit different in the therapeutic assessment model is we certainly can talk about diagnosis if that's what's important to people. But in my experience, what most people are looking for is answers to questions that are more personal, related to their life.
Yeah.
And so the first step in a therapeutic assessment is a session really focused on helping people figure out, what are you trying to learn about yourself?
Right.
What do you want to know about yourself through the testing? And we develop what we call the assessment questions with them together. And I find only about 5% of those are like a true diagnostic question. The other 95% are often areas of a person's life where they have been trying to make some change, trying to have something be different, and they can't quite get there. They can't get the traction, or they can't quite figure out, what's happening here. And it's these problems in living, these areas of people's lives where, this is really where psychological testing can be really helpful if we use it correctly to help people understand these parts of themselves. But this requires not only the test data, but a collaborative discussion between the assessor and the client. I often say, and I'm quoting Steve Finn, who's one of the primary people in therapeutic assessment here, but I'm an expert on psychological tests. You're an expert on your life. Let's put our expertise together, see what we can figure out.
Nice.
Right.
Oh, I like that.
So that
Yeah.
clients can get these answers, right?
Yes.
And I often think, it's not easy for clients to reach out for help. Even if it's a step of saying to a doctor, I want a medication, or to a therapist. And testing in particular, I think, feels like an even bigger step.
Right.
And so I really hold these areas of people's lives with a fair amount of respect and compassion, because if you come to me and you're saying, well, Raja, as an example of the question, I want to know, why can't I seem to commit in a relationship?
Yeah.
I work under the assumption you've been trying to figure this out in all sorts of ways. For some clients, of course, that's in their own mind, right? Where they've been just thinking through it and they've been trying to solve that problem. Or some people might turn to like a self-help book. Some people might turn to a professional, or some people, turn to friends and family for help. But, human beings tend to try to solve their own problems on their own.
Right.
Or with the help of people that they trust before they say, maybe I should go talk to a therapist.
Yes.
And even that happens before they say, well, maybe I should get some psychological testing. And so it's really about these questions. This becomes the core around which the therapeutic assessment process moves. We're trying to figure out the answers to these questions together.
People might come in wondering, why are my relationships so difficult? Why can't I seem to, forgive my parents or something like that, right? Are there non-relationship questions that people come in with?
Sure. The variety of questions is pretty large, but ultimately they also have to circle around just parts of people's psychology.
Sure.
And of course, there's just core parts to us. So many of the questions are about relationships. That's very common. Questions about emotional life, right? Like, what's contributing to my anxiety? Or what more could I do to help my anxiety? I recently had a client ask, why don't I cry? So they're trying to figure out what's going on for them, themselves emotionally, right? So we get a lot of questions around there. It's not uncommon that some core area of someone's life is feeling like it's not quite going as they would like, right? Why have I always hated work? If we think about work for adults being a core part, or for younger people, what's getting in the way of, if we're doing it with an adolescent or child, what's getting in the way of my son or daughter having academic success? And so the questions are really about these different parts of people's world, internally and externally, that we're thinking about together. There are, of course, some questions like we can't answer. Like if someone says, well, Raj, I want to know, when will I find contentment?
Yes.
I'm sorry, I wish that I knew the answer to that myself, right? This is something we're all longing for.
You don't have like a crystal ball.
I do not have a
or
crystal
something.
ball, right? And sometimes people have questions about things within a relationship that really requires one of the other models. You had asked this earlier, kind of, so let me come back to it and illustrate it through this example. Because an adult might come in and say, well, my question is, why do I constantly have fights with my partner? Mm-hmm. Well, in really answering that question properly, we're going to need to know you and your partner. And this might be a case where we do the couples therapeutic assessment model.
Oh, interesting.
Yeah.
Yeah, because we don't really talk about
We don't talk
assessments
about
of
that.
couples
No,
in
no.
psychology.
It's not as widely known, nor is it as widely practiced. There are not that many people actually doing it, but it is one of the 4 models. So there's the adult model, which we'll probably talk the most about. It's the easiest to kind of think about. This couples model, there's an adolescent model, and a child model.
Okay.
Right? And so just to illustrate this idea, right, I might be meeting with parents who want to know, like, what more can we do to support our child who's struggling in school? Well, this is a little bit about the child, but we also want to know about the parents. Mm-hmm. And so in the child and adolescent model, we actually often have parents do their own testing.
Oh, interesting.
Because then I can see, like, well, here's who you are, and here's who your child is, and we can look for, of course, points of alignment and points of misalignment, and think together about, what maybe is getting in the way there. What causes some of these difficulties? Now, that's not an easy step for parents to take on either, right? It's one thing to say, hey, I'm going to give my kids some help. It's another to say, oh, I got to look at myself and think about myself.
Yeah.
I mean, that's hard for all of us.
Yeah.
But a good assessor is going to be aware of that and make it not so scary, if you will.
And the reality is that, anybody who's working with kids, how important the parents are in, whatever is happening with the child. And not that they're to blame, they're not.
No.
It's about how do we all come together to help our kid. And so understanding the parents makes so much sense.
It does. And you and I know as parenting this.
Yes.
What a tough job this is.
Yes.
Right?
Yes.
And we're psychologists.
Right. I know that PhD did not help in that area.
I hold all my clients with a lot of compassion, but parents specifically, because we're also under so much pressure from the world or culture around doing this parenting thing the proper way. We're all just humans trying to do our best.
Yes. Yeah.
So I'm sorry, that was a bit of a tangent there.
No, I love that. Okay,
But I think
so
it's true.
so exciting though that you can do therapeutic assessments with couples, with kids and their parents.
Yep.
Just so many different avenues to get answers to really important questions. I mean, diagnosis is great, but that's not going to change anything from, the day before to the day after. You just, something. Right. But this is really about making change.
Yeah. And, if you met, ADHD is a very common reason why someone would be referred for testing. This is for that ADHD or not. It's a very complex disorder to kind of look at, although there's varying opinions out there about how much evaluating needs to actually happen. But, if you met one person with ADHD, you met one person with ADHD.
Right.
And so these other parts of the person become important as well. But I also I encourage anyone who's listening, who's thinking about testing, to think about this factor. Is like, well, what question are we trying to get the answer to?
Yes.
And how is that going to help whatever then decision's going to occur from that? Right. And of course, sometimes we just want to get ADHD so this kid can get accommodation to school, and whether we should try medications. Mm-hmm. And so, maybe a traditional eval where it's going to be shorter in duration, in kind of what all that goes on, and it makes complete sense. Right? That might be exactly what you need.
Yes.
So there's certainly times approaching things from a more traditional approach makes 100% sense.
Well, and I can think of, you are probably getting a lot of referrals from other professionals, right? Like,
Yes.
I'm not sure, what to do next with this client's kind of stuck, or, and so when you get those referrals, is there an extra layer that you have to do to try and understand what the question is coming from the therapist or the doctor who's referring them, or how do you navigate that?
Yeah. So we definitely want to include these important people in this process, right? I mean, people really should, if you have a therapist, you should really have one therapist. Like
Yes.
people should not have multiple therapists. This is a terrible idea, and therapists should not allow that.
Yes.
But if I'm going to step into a therapeutic endeavor with someone, which therapeutic assessment is it, that's right there, right? I want to bring whoever's in the treatment team, if you will, into this conversation as well. And so I do often get people who have been in therapy for some period of time, and the therapist and the client have had a discussion where they recognize together, like, we've kind of plateaued, or we're not kind of getting the progress we want.
Right.
And they often need something to help them move forward and shed further light on, like, what needs to kind of be addressed. And I don't mean that just simply in a symptom way, because you really don't need testing for that. Right? We can do some really good interviewing and understand some important parts about people's symptom experience, like symptoms of depression or symptoms of anxiety. But what's more kind of underneath the surface, if you will, a bit, that are contributing factors. And this is kind of related to the different tests we do, so we should make sure we hit on that.
Yeah.
But I'm always bringing them into the process and then collaborating with them as we go, because ultimately my job as a therapeutic assessor is to meet with people, do the therapeutic assessment, and then for many people, keep working with their therapist. So I want to make sure that, the therapist and I are aligned. And of course, if you've been working for a therapist for a number of years, that therapist knows a lot about you.
Right.
That's really helpful information to me that I can learn from also.
Absolutely. Well, and before we go to the, what might be included in the assessment, I'm wondering, like, so you mentioned earlier, kind of the first appointment is trying to decide what those questions are.
Right.
So what does the process look like?
Yeah. Let me take us there for a bit. So we have that first session. We figure out, what are you trying to figure out? Mm-hmm. And these questions are really important for a few reasons. But one of them is it helps make sure I'm focused on what's important to this client. Right? The client's basically saying, here, Roger, this is what I need to know. And I'm saying, okay, this is what we're going to figure out then. And then two, it helps me figure out what tests I'll need. And so just as a quick example of that, it's not uncommon. I get people who have actually already had an ADHD evaluation, a traditional evaluation. So maybe they come and they say, Raja, 2 years ago I had an ADHD evaluation. We did all that type of testing. I already know I have ADHD or I don't have ADHD. And so that's not part of the picture here, right? So with that type of client, I already know, like, I can get that report, I can look at that data, I can use it to help me with my thinking, but I also don't need to re-examine that.
Yeah.
Conversely, if I've got a client who says, one of my questions is, why do I have such a hard time focusing? Is it ADHD? Well, now I have to include some of those kind of tests into this battery of tests that we're going to be doing, right? So the questions are really important to guide both decision making and make sure our focus is in the right place. Once we've established questions, then for many of the adults that I see, it winds up being 8 or 9 sessions. Most of those sessions are 90 minutes, sometimes 2 hours. And often what's occurring is some testing and then some conversation. And so sometimes I will administer a test and score some parts of it or think about some parts of it and almost immediately invite the client into a discussion around some of the things that occurred. Because as I was kind of mentioning earlier, when people do testing, things essentially bubble up.
Yes.
And we can see things in the testing that sometimes clients have awareness of and sometimes they don't have that much awareness of. And if I then invite the client into a discussion around this, this is the therapeutic part, where we really start to figure things out together. And of course, I'm forming hypotheses as we go, and sometimes I'm looking at something and I'm thinking like, well, you know, it seems like this. What do you think? And sometimes the client says, oh yeah, Roger, that's totally it. But sometimes they say, no, actually, Roger, that's not it. But both of those bits of data are equally helpful.
Right.
Right? This is what us trying to make sense of it together.
Okay.
And so it's a series of appointments. Most adult TAs usually span around 3 months. So it's a commitment, right? If you're gonna engage in this, you're gonna be taking on something that's bigger in scope. And it's those kind of sessions, somewhere in between there, I'm connecting with that therapist or whoever referred and having conversations with them or looking at old records if that's part of it, until eventually we get to a point where I feel like, okay, we've got enough testing, we've had enough conversation, we can answer the questions. And then we have what's called the summary discussion session where I meet with the client and if possible, my preference is to go to the therapist office, meet with the client and the therapist there together. In the back end of the whole process, I send a letter to people that kind of captures what we figured out together and answers their questions. And this part is very, very different also from a traditional evaluation. In the traditional evaluation, at the back end, the written communication is a report.
Yes.
And you can even just think about report versus letter. This is different language to capture a type of document. And oftentimes reports are written for professionals, even though we know clients will read them. But there's a lot of jargon in our field. And these reports can sometimes be very confusing for our clients. Whereas this letter is really written directly to the client using language that's going to be understandable to them. And the thing that people say to me at the back end, often clients will say is, Roger, I had no idea how much conversation we were going to have. Right?
Right.
But that's a big part of it. I got to learn from them and I'm going to help them understand themselves and we're going to figure some stuff out together.
Well, and that also speaks to, I mean, they're actually meeting with a psychologist the whole time.
Yes.
There's not a psychometrist or a tech who's administering the assessments to them. You're there the whole time.
Right. Yeah.
How would you describe the test part of it to
Sure, yeah. So, I mean, broadly in the field of psychology, we have different types of tests we can kind of put into different categories. And the tests we would use in a therapeutic assessment are the same tests we would use in a traditional evaluation. So it's not like there's differences there. Whatever test is going to help us answer the questions is what we need. Mm-hmm. Within our field, we have a group of tests that we might put under what we call a neurocognitive or achievement test umbrella, if you will. So these are IQ tests. These are tests of memory, tests of attention, tests of language. There's a number of achievement tests that can help us figure out, are people reading at the level expected or writing at the level expected. They're very helpful in diagnosing learning disorders like dyslexia. So there's that whole grouping, which many people are most familiar with, because if you do an ADHD eval or if you have a kid who needs some help at school and you're worried about does my kid have dyslexia, right? This is usually the battery of tests that people are going to take. The other domain is more under an umbrella around personality, who people are, their emotional lives, their social lives, how they think about things, process the world, make sense of things, their coping skills, their attachment style. In these tests, we often get some sense of symptom picture, like what's going on for people, where does it compare to others. I'm a doctorate in clinical psychology, and I would say I'm a clinical psychologist. I'm really kind of a personologist in that I think personality is fascinating. Yeah. And so this is where I think at times in the testing world we've kind of lost sight of the importance of personality and understanding people and gotten a little too focused on some of these just cognitive elements. But it's very difficult to be an expert in both.
Yes.
There are very few psychologists that are highly skilled in neuropsychological testing and highly skilled in personality testing. Right, so that's a part of it as well. Within the realm of kind of personality and symptom tests, there's a whole variety there. Some of them are very simple and many of which people are familiar with. If you've ever gone to the doctor and they said, fill out this quick form called the PHQ-9, you've taken a symptom inventory of depression symptoms. And some of these smaller measures that are just kind of capture symptoms, help us understand what's having an experience like that or not, are very helpful. Within the world of kind of personality testing, there's a few things that we can do. And there's two broad domains there. They're what are called the objective self-report measures and what are called the performance-based measures, or historically they were called the projective measures. Within that self-report grouping, these are similar to what people have the potentially have experience with. So if you're ever taking the Myers-Briggs, this is telling you something about your personality, right? You're looking at these items and you're answering, is this me or is this not me? Or the MMPI is the most widely used of all these self-report tests. A lot of people have taken that for work or in other circumstances. And these tests are really great because they help us understand what people know about themselves. In that other grouping, there's a few tests that are kind of primary, the most well-known of which is the Rorschach ink-blot test. And we could spend a whole nother podcast on the Rorschach, because it's far more complicated than people think, of course, and how it's portrayed in the media. But the Rorschach is really helpful in understanding, both many of these same elements, things like emotional life and interpersonal style and thinking style, right? So we're getting some of the same data, but we often get some of this data that people have less awareness of. And so there's the Rorschach. There's a lesser known test, but it's common in the TA world called the Bartag drawing completion test. This is a fascinating test that also came out of Europe around the same time that Herman Rorschach was there. Eric Bartag developed it. And it's growing in use in the United States. And it also provides amazing data. And another that's commonly used in the TA world is the adult attachment projective, which is a storytelling test that can help people understand people's attachment status, which is that kind of basic way we relate to others given our early experience with caregivers. And these tests can kind of shed light again on things that I tell clients. It's like, this is kind of what's under your hood a little bit. Right. You might have a little less awareness of some of these things. And so if we can put it together, then we can get this more holistic holistic view of people. Here's kind of what you know about yourself, and here's a little bit of what's tripping you up. And one of the challenges we have is being a human being. We live in an incredibly complex world.
Yes.
And we are bombarded literally by stimuli all the time, right? Through our eyes, through our ears, through all of our senses. And so as animals, we've had to learn to kind of work on autopilot. Because imagine if we had to constantly stop and think through every conscious decision, we'd be thinking overwhelmed. So we are creatures of habit. Super helpful for allowing us to be productive and being the advanced animal, if you will, that we are. But this also means that sometimes we do things without recognition. And these second groupings of tests, these performance-based measures, can sometimes help us tap into some of that, or sometimes even some stuff that might be what we consider subconscious, where it's just people just don't have quite the language for understanding what this is, even though sometimes it's buried somewhere in there, whether they kind of know it or not. Yeah. And that's what trips people up, honestly.
Yes. Well, and I think of your question, right? Like your sample patient at the beginning that was talking about difficulties with committing, right? Like this seems like the measure or the measures, the performance-based measures is the only way you're going to get to that.
Yes. Right. Yeah. We have these experiences in life that are inevitably going to be challenging. This is just part of the human condition. And it's not uncommon for all of us that those experiences can get stuck in us.
Right.
We hold them in our bodies where they get buried in our subconscious. And oftentimes we might think things like, oh, that was nothing, or that didn't bother me so much, or that's not, that didn't impact me. But it can be in there for some people.
Right.
And still pop up in ways that they don't totally realize and contribute to some of the difficulties they experience.
Well, and there's a lot of talk about neurodivergence and people that might be on the spectrum, and one of the ideas or one of the symptoms really of people who may be on the spectrum is that self-reflection is harder for them. And so I'm wondering, is this TA, therapeutic assessment, really kind of a good measure or a good way to approach helping people who might have those blind spots in terms of their social skills or other dynamics that they find themselves in, to getting answers they need to change.
Well, if I take it to a higher level for 1 second, the research would suggest this model can be efficacious, helpful to all sorts of people. Level of self-awareness, your ability to understand what you're feeling, label it, your ability to kind of think about your thinking is a beneficial skill set. And when it comes to making use of psychological services like therapy, that often can help people kind of move along quicker. The absence of those abilities, though, doesn't necessarily preclude people from stepping into those kind of services, but they might need some extra help, if you will, to understand these parts of themselves and then figure out, how do I take this forward? Right. Ideally, what happens in a TA is I do some testing, something bubbles up, I talk to the client about it, we have some conversation, they start thinking about it, they leave my office and they keep thinking about it. And maybe they even go back to more people in their lives, like a partner, and say, I was talking to Raja about this thing, and I'm starting to think about this, and what do you think? Yes. Right? Like trying to invite people into conversation. But if you're not naturally prone to self-reflection, well, you're not just naturally going to do that. Right. Does that mean TA or other therapies could be efficacious? No, it certainly could be. Right. The place I get a little curious about is, let's think about what that's about for you. What do you think it is about self-reflection that maybe it doesn't come as naturally to you as it does for other people? And of course, it's certainly possible, given temperament, genetic loading, some people are coming to the world in that way. Right. And this is just their, the genetic hand they've been dealt, so to speak. Sure. But sometimes it's hard to self-reflect. Sometimes it's hard to look at ourselves.
I mean, it's hard work for these clients when they're doing this. But so rewarding because it can really change their life and their relationships. Right. So self-reflection is one of the things that people need at least a little bit of, or a willingness to try to do a therapeutic assessment.
To me, if I meet someone who struggles with self-reflection a little bit, then I'm going to be thinking a little bit broader around what's going to be helpful to this person to move forward. And just to illustrate that example, people who have intellectual and cognitive deficits tend to have a lower level of self-reflection. And so their ability to kind of hold themselves and think about themselves, right, is just underdeveloped in comparison to folks that don't have those kind of deficits. And they often are living in systems with people that don't always understand them the best. Mm-hmm. And so for some of those folks, the intervention might be more around bringing those other people into the conversation.
Okay.
Right. Yeah. So here, the simplest example would be, if that was the case with the adolescent, well, if you have a kid who's got some of the struggles, you can get frustrated with these kids. They can be kind of challenging. Yes. And they might not be able to attend to things the way you think that they're going to be able to. And helping then a parent understand these parts of their child and the dynamic that's occurring there and how to help them hold their child in a different way could be really impactful. So there we might think about the intervention or how we're trying to create change is happening in a kind of a different way.
Right. It may not be that their child is actively defiant. Their brain just might not have the capability to do certain things.
Right.
Yeah. Interesting. So then it's working with the parents to help support them.
Potentially. But sometimes developmentally we're not at a place where something can click for us that we understand about ourselves, the world, others. And I suspect many people can resonate with the experience of moving along and something just happened in life, some meaningful conversation, something else that all of a sudden they're like, I never quite thought about it that way or never quite realized that. Right? So that can happen in all sorts of ways. And so for even someone who comes into a therapeutic process, right, some people might leave and think like, well, that was helpful, Raja, but I'm still quite I'm not sure I totally am certain about some things, but I think I've got enough here and move along. And then at some point in time, it might click. Mm-hmm. And I'm also like, this is what Raja was talking about. There he is. right? And it's almost like I kind of picture it almost like their brain had to catch up.
Which, again, great that they have a letter, too, to kind of
Yeah.
look back
Right.
at every so often and,
Right.
oh, this part now makes more sense to me. Yeah.
Exactly.
Yeah. Tell us a little bit about who does therapeutic assessments.
This is a little bit of the tricky part, unfortunately. Yeah. So it's a model that's been around for some time now. But one of the most seminal articles out, journal articles came out, roughly 1992. We've seen some of the basic concepts and skills be infused into how we're educating future psychologists around this, but the number of practitioners actually doing it, remains low in comparison to the number of evaluators who are doing a traditional evaluation. The Therapeutic Assessment Institute is the primary professional organization that kind of houses, if you will, information about therapeutic assessment, conducts educational opportunities for professionals, and there are some resources on clients there. So if someone's like, well, this sounds interesting, Roger, I wanted to learn more, therapeuticassessment.com would be the natural place to go, and you'll see a section there for clients that they could look at. And there's a list of people who have, there's two levels of kind of certification. There's full certification, and then there's folks who have demonstrated a basic level of competency through an examination. So you can find some people in your area. It is true, not just in the United States, but across the world, there are pockets where there's more of these folks, and there's pockets where there's less. Even here in Minnesota, where I've been educating people and trying to train people, we don't have that many people who are doing the full therapeutic assessment model still. In the Bay Area, California, San Francisco, Oakland area, there's more. In Southern California, there's more. Up in Colorado, where there was a number of people coming out of the Denver University's PsyD program, there was a professor there, Hal Martin, who is a big leader in the TA world, and he taught assessment courses there. So he had a number of students being educated in the model through his great work. So we see kind of pockets of the country where it's a little more widely known. But a quick Google search is going to get you somewhere there, or therapeutic.assessment.com website would be the place I recommend people to go.
So it's something that certainly we recognize the need for, and it's going to be difficult for some areas of the country to be able to find someone who does this. Now, after COVID, a lot of things switched to online. Can we do a therapeutic assessment with a provider somewhere else?
You can. We can now. I mean, COVID was difficult, of course, for many reasons, but the assessment field that was used to face-to-face testing, we really had to think hard about how do we do this thing. Thankfully, a number of people had already been thinking about this. Jordan Wright is a psychologist in New York who's done a lot of great work on this. And because people were recognizing there was pockets of the country where psychologists weren't able to do testing, and when it came to kids specifically who needed testing to figure out special education services, right? How do we get that, need that? And so we were able to quickly adapt. We can do a number of tests now virtually. There are still some that we can't do online, but a lot of it can happen that way. The tricky part comes more with the licensing laws, which is really about who's got jurisdiction over professionals within the field of psychology, which is where you're going to find someone who can do testing, right? Doctoral level psychologists are primarily the people doing testing. Master's level clinicians are not trained in testing in large part. There's probably some pockets of the country and world where there are master's level people doing testing, but in the US, they're mostly doctoral level folks. And licensing boards for doctoral level psychologists is done state by state, but there's this new system called PsyPact, which allows people to see people in other states, but you have to apply for that. So not every psychologist is of course, willing to do that or wants to do that.
Sure.
But there are psychologists that have done that, and that might be another avenue.
There might be more options
There might be
online
more.
if there's not
Yes.
somebody there.
Yeah.
But it's always going to be a psychologist, or generally will be a psychologist that you're looking for because it requires a doctorate level.
Right. Psychological testing is complex.
Yes.
You need a few courses to really understand what we call the psychometrics, the underlying science behind the test, how best to think about it, and how to best to interpret them. The administration of many tests is not that complicated. This is why we have psychometricians. But making sense of the data in context of other data is really the important part, frankly, but also the skill part.
Yeah, that integration and then
Yeah.
what do I do with it? What does it say in terms of benefits and is there additional topics that were need to be developed in terms of research?
We still don't know, but people are thinking about the mechanisms of change, what we call it, like what's actually happening in this process that allows for the outcomes that we've seen in the research. And part of that difficulty in knowing that is this is not easy research,
Right.
because it's not a simple model, right? It's not like just someone meets for one time, has some conversation, and then we try to measure something pre and post. There's far more that's happening in this process. But there's now, I think, like 40 published research articles on it, as probably as many other articles that are related to the topic. There's many case studies out there, 4 primary published texts on the model, and now 3 meta-analyses that have looked at some form of using psychological testing in a kind of therapeutic manner, or engaging people in a collaborative assessment process. And we see essentially good effects from these. So it's very similar to what we see from other therapies. Cognitive behavioral therapy is kind of the gold standard when it comes to at least the research and what that suggests about efficacy. And therapeutic assessments have a similar level of efficacy as related to how we're thinking about it from a research standpoint. But what the research would suggest, I'm sorry to come back to your question, is it potentially can impact things like self-esteem, feelings of hope, feelings of trust and willingness to engage with providers, which might sound simplistic to some people, but for other people, that's a huge thing.
Yes. Yeah.
There's also some research suggesting that it's essentially helping people get ready to move into what might be what takes them forward.
Yes.
So within this model, we see the span, if you will, of potential outcomes for people. On one end being, I've done therapeutic assessments with people where they got to the end and said, "Gosh, I feel like I got what I needed out of this. I don't think I need therapy or anything else."
Yeah.
And other people who said, "This has been really helpful. I feel like I now have a better sense of where I need to go," and the lens of therapy got sharpened.
Nice.
We're focusing more on what's needs to happen. And a little research even suggests that the trusting relationship that often gets developed with a TA assessor enhances the relationship they have with other providers. So they can then maybe step into their therapy experience feeling more safe and secure, which is so important.
Yeah, absolutely. Almost like they've learned the language through the therapeutic assessment to bring to therapy, maybe, or but something happens that they're able to carry it into that therapeutic relationship. Nice. And I feel like when clients are doing therapy, those first few sessions are about building motivation and insight and the relationship. And how cool that you can do an assessment and just bring that right to the therapy.
Right. And we've been talking about the model relative to maybe someone who's already been in therapy.
Right.
But it's really a great entryway to therapy.
Oh, sure.
Right? So if someone has not been in therapy, starting with the therapeutic assessment, getting some clarification around, like, where should I be going? Like, what type of therapy should I even be doing? Which is a very complicated thing for people. Right? I mean, the mental health system is so confusing to clients. I really do appreciate how difficult it can be, because you just see these names and you see these initials and, some of the lingo, people kind of have a sense of like CBT and DBT is kind of out there. But really knowing like, what do I need and what kind of therapist, right? That is not easy to figure out.
Right.
Without some guidance. So it can really be helpful in that too. Like, you really should be working with this type of person that's doing this kind of work.
I kind of feel like, the assessment piece, this therapeutic assessment, can kind of give us a window into really what is the best intervention for you, so
Right.
you are aligned with the right treatment option, because there is so much right out there. There's
Right.
like you said, all these different
Right,
acronyms,
right, right.
EMDR, CBT,
Right.
and so and the general public doesn't know, right? And they can't know, and they're not expected. They didn't get a degree, that
Right, right,
so
right, right.
so starting with a therapeutic assessment, understanding what it is that you need,
Yeah.
and then
Any kind of testing is potentially going to help people with some of that.
right.
So even if you go and do a traditional evaluation, because you can't find a TA assessor, right, and say, well, I really want to just know, like, what does the testing say about what's going on with me and what type of treatment is best for me,
Yes.
right? Plenty of psychologists can answer that question, regardless of which model they practice.
Before we go,
Yeah,
I know our viewers will want to know more about you and
Sure.
where they can find you. Tell us where we can look for you online.
sure,
and-
sure. Well, if you're wanting to know, about therapeutic assessment broadly, I really recommend you go to therapeuticassessment.com. My practice is the Minnesota Center for Collaborative Therapeutic Assessment, which I realize is a mouthful, but it's www.mnccta.com. So that's Mary Nancy Charlie Tango Alpha.com.
Impressive.
Clearly, I'm saying that quite often. And you can find information there about me. I also have some information about the therapeutic assessment model on my website if people want to learn through that way as well. And you can easily access me through my website.
Wonderful.
It's not uncommon. I get people reach out, and sometimes they do want a TA, and sometimes they think they want a TA, but they actually maybe be better served by something else.
Sure.
And so, I do try to help people navigate some of that decision making a little bit as well.
And certainly, psychologists or others who want to learn more about
Yeah.
therapeutic assessment, you're doing workshops.
Yeah, so I do. I'm in a kind of a rotation of doing 3 workshops a year. That's my introduction to therapeutic assessment. It's a virtual workshop. It's a spring, summer, and fall. And then peppered in there, I usually am doing some other things. I build some other workshops, or I wound up doing presentations for other organizations or professional conferences. So if people want to learn, also, if you're a professional, don't hesitate to check out the website. There's information about trainings there also.
Your publications.
And
if you
yeah,
wanna read.
there's the book I mentioned that I co-authored is there. Some of the publications I've done are there. So
Well, thank you so much.
you
for
bet.
joining
Yeah,
us
it's a
today.
pleasure to have this conversation with you. Thanks for inviting me.
Yeah, absolutely. Thank you for watching as well, and please make sure to like, subscribe, and comment.